Hello, welcome you all for another important video. So in this video, I'll be discussing on an important anatomical region in the skull. It is the infratemporal fossa. So now let's see what is this infratemporal fossa. As the name implies, it is inferior to the temporal fossa. So this is the temporal fossa area. So below that we have the infratemporal fossa. Now you can see the area of the infratemporal fossa. So this area is important as a passageway for neurovascular structures, and this area protects them from the external factors. So now let's see the borders of the infratemporal fossa. So the medial border, the medial wall is formed by the lateral plate of the pterygoid process of the sphenoid bone. This is the lateral plate of the pterygoid process. So medial wall is formed by the lateral plate of the pterygoid process of the sphenoid bone. And posteriorly in the medial wall, there is the pharynx and the tensovelli palatini muscle. Medial wall is separated from the anterior wall by the pterygomaxillary fissure. The superior wall or the roof of the infratemporal fossa is formed mostly from the infratemporal surface of the greater wing of the sphenoid bone. So this area, and some part of the roof also formed by the infratemporal surface of the temporal bone as well. This is the temporal bone, the pink one. The roof of the infratemporal fossa, there are two foramens. This the large one is the foramen ovale, and this one is the foramen spinosum. Now let's see the anterior wall. So it is just posterior to the maxilla. So the anterior wall is formed by the infratemporal surface of the maxilla. At the upper margin, there is inferior orbital fissure as well. So it's the maxilla area. So it forms the anterior border. So now let's see the lateral wall. Lateral wall is formed by the ramus of the mandibular bone. The ramus of the mandible form the lateral wall. And the posterior wall is not well defined, but it is mainly formed by the styloid and the mastoid process of the temporal bone. And there is carotid sheath as well. So the floor of the surface is wide open and it communicates with the neck region, and it extends up to the level of the base of the mandible. So now you know the borders of the infratemporal fossa. Now let's see quickly what are the contents of the infratemporal fossa. So the contents mainly the deep part of the parotid gland, and there are several muscles. The temporalis muscle insert into the infratemporal fossa. This is the temporalis muscle, and it insert into this infratemporal area. And there are two other muscles, the medial and the lateral pterygoid muscles. They are well inside the infratemporal fossa. This is the lateral pterygoid muscle, and this is the medial pterygoid muscle. And we can see the maxillary artery and its branches, and pterygoid venous plexus, mandibular nerve and its branches, and the otic ganglion, chorda tympani nerve, and posterior superior alveolar branches of the maxillary nerve. So this is the maxillary artery. It's coming from the external carotid artery. Now this green area is the pterygoid venous plexus inside the infratemporal fossa. And here the green area which is enlarged here, it is the mandibular division of the trigeminal nerve, that is the fifth cranial nerve. Here you can see the chorda tympani. Now it is enlarged here, and this is the otic ganglion. Now you know the muscular, nervous and the important vascular structures inside the infratemporal fossa area. So the deep part of the parotid gland and the medial and lateral pterygoid muscles, temporalis insertion, maxillary artery and its branches, pterygoid venous plexus, mandibular nerve and its branches, and that is the mandibular nerve from the fifth cranial nerve, otic ganglion and the chorda tympani nerve, and the branches of the maxillary nerve as well. So we can see that this is the parotid and deep parts inside the infratemporal area. So the main vessel inside the infratemporal fossa is the maxillary artery. It's the terminal branch of the external carotid artery, and it runs superficially, and within the fossa it gives rise to several branches including the middle meningeal artery, the inferior alveolar artery and mesenteric artery and buccal artery, and anterior and posterior deep temporal arteries. The middle meningeal artery is one of the larger branches that courses superiorly and passes through the superior wall of the fossa via the foramen spinosum. So thank you very much for listening to this short video. We'll come with another important anatomy video in a short while. So if you have any questions, please comment down them and subscribe to the channel for more future videos. Thank you very much.